New Hampshire Governor Chris Sununu gained a lot of knowledge Monday about ways to battle COVID in New England, where numbers aren't nearly as bad as they are in other parts of the country, at least not yet. That's why the Republican governor reached across the aisle to get proactive in helping his state beat COVID.
Contrary to popular belief, COVID doesn't have a political party. Doesn't care what your political party is, especially the Delta variant.
We got to have a real frank conversation. Everything we talk about, if we could go back in time, what we might do a little bit differently.
An indiscriminate virus that is overwhelming hospitals across the country.
On July 9th of this year, there were 7 patients in my entire system with COVID. This morning, there were 164.
And putting pressure on urban health systems like U of L Health here in Louisville and smaller systems in rural areas like Frankfort. New Hampshire's governor traveled to Kentucky Monday to get tips on how to keep up with and even stay ahead of the latest COVID surge.
What we saw here in Kentucky were hospitals trying to do some innovative things, trying to manage that very high capacity, whether it's with beds or ICUs, using ventilators, how they're using therapeutics.
The biggest one that we spoke about today was the use of the monoclonal antibodies to treat people that were at high risk for exposure or at high risk after a positive test.
It's important because it's one of the most used therapies to keep people out of the hospital after they've contracted COVID. The other issue of interest to Governor Sununu was keeping hospital staff up to par and allowing them the space to recharge while providing critical care.
From that standpoint, it's how do you make sure that you have enough nurses, and how can we bring nurses in from other areas that aren't hit and kind of follow the wave, as I say, across the country as this moves forward.
And we're just looking for the best ideas in the walls of the hospitals to make sure that when push comes to shove, we can provide the best possible care, be as proactive and preventive as we can to ensure that our entire system doesn't get overrun, because we know cases are going to surge, hospitalizations are going to surge, and we got to be ready.
Stefan Dingle, WLKY News.